So today I am going to demonstrate AP axial projection and lateral projection grande method for the cervical vertebrae.
For AP axial projection, I am going to use 8 by 10 inches or 18 by 24 centimeter lengthwise of image receptor. The patient is placed in the AP body position. It's either recumbent or upright. So we're going to center the mid-sagittal plane of the patient's body to the midline of the table or vertical grid device. To adjust the patient's shoulders to lie in the same transverse plane to prevent rotation. So we have to extend the neck enough to place the occlusal plane and mastoid tips in the same transverse plane to prevent superimposition of the mandible and the mid-cervical vertebrae. So adjust the position of the cassette so that the center of the cassette will coincide with the central ray, and the respiration is suspended for the exposure. As for the central ray, direct the central ray through the fourth cervical body at an angle of 15 to 20 degrees cephalad, so it enters at or slightly inferior to the most prominent point of the thyroid cartilage. So this projection shows the lower 5 cervical bodies and the upper 2 or 3 thoracic bodies, and the shadows of the mandible and occiput that superimposed over C1 and most of the C2, the interpediculate spaces, and the intervertebral disc spaces. Also, the spinous processes should be equidistant to the pedicles, and mandibular angles should be equidistant to the vertebrae. For the lateral projection grande method, we're still going to use 8 by 10 inches or 18 by 24 centimeter lengthwise image receptor. For the patient's positioning, place the patient in a lateral position, either seated or standing, before a vertical grid device. So have the patient stand straight and adjust the height of the cassette so that it is centered at the level of the fourth cervical segment. Center the cornal plane that passes through the tips of the mastoid processes to the midline of the film. Move the patient close enough to the stand to permit her to rest the adjacent shoulder against it for support. To rotate the shoulders anteriorly or posteriorly according to the natural kyphosis of the back. So if the subject is round-shouldered, rotate them anteriorly. Otherwise, rotate them posteriorly. So adjust the shoulders to lie in the same transverse plane. Depress them as much as possible and immobilize them by having the patient hold one small bag in each hand. Adjust the body in a true lateral position with the long axis of the cervical vertebrae parallel with the plane of the film. So elevate the chin slightly to prevent superimposition of the mandibular rami and the spine, and with the mid-sagittal plane of the head vertical, ask the patient to look steadily at one spot on the wall to aid in maintaining the position of the head. Direct the central ray horizontally to the fourth cervical vertebra. With such centering, the magnified shadow of the shoulder farthest from the film will be projected below the lower cervical segments. Because of the great part film distance, an SID of 60 to 72 inches should be used to obtain the finest possible definition. This method presents a lateral position of the cervical bodies and their interspaces, the articular pillars, the lower 5 articular facets, and the spinous processes. So depending on how well the shoulders can be depressed, the 7 cervical vertebra and sometimes the upper 1 or 2 thoracic vertebrae can also be seen. The neck should be extended so that the rami of the mandible should not overlap C1 or C2. The rami of the mandible should be superimposed or in very close approximation, and the fourth cervical vertebrae should lie in the center of the radiograph, and the exposure should demonstrate bone details and soft tissues.